Now, at the same time, we see promising trends across the United States. We're seeing concerning trends throughout much of Europe. The combination of the more transmissible BA.2 variant, as well as reduced mitigation measures and waning immunity, is leading to increases in COVID in nearly all of Western Europe. The UK, Germany, France, Italy, Portugal, Switzerland, and others. Now, meanwhile, our own levels of BA.2 here in Wisconsin also continue to increase. Most recently, we hit 27% of sequenced virus being BA.2 in Wisconsin. Now, on one hand, that's a level that's nearing that of the European countries where COVID is now on the rise. It seems we're about 3 to 4 weeks behind the UK on BA.2's predominance. And the UK is currently seeing a rise in COVID cases and, more concerningly, in COVID hospitalizations as well. But on the other hand, we've seen that it's hard to use trends in other countries to predict what will happen here. We can be hopeful that our recent surge from Omicron may have provided a level of at least short-term immunity among our population that, coupled with vaccine-induced immunity, can blunt the impact of this variant. So in the coming weeks, we may well see an increase in cases, hopefully a relatively small one, or we may merely see a slowing in our downtrend of cases. But one way or another, looking to the future, this is not the last variant that we'll see. We don't know what the next iteration of COVID will look like, but what we do know is that the best way for us as a community to be future-proof in the face of new variants is to increase our vaccination and booster rates. And we continue to see low levels of vaccination across the county, but particularly among populations of color and younger populations. So we should take advantage of this moment of low disease burden to reach out to family, to friends, to neighbors who are not yet vaccinated, to share our experience and help them to become more knowledgeable and comfortable getting the vaccine and getting themselves protected.